TV stations will get started in 1 minute. TV stations will get started in 1 minute. Thirty seconds. 30 seconds. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody. I hope you had a great weekend. Here with Josh and Paul, and back by popular demand, Deirdre Gifford. You'll see why in a second. This is probably going to be one of our last COVID daily summaries, if the numbers continue as they are. This is for 3 days. You can see our tests are going down a little bit for good reason. Positivity rate, 0.9%, less than 1%, third time in a row. Less than 1%, barely less than 1% over the last week. That hasn't happened in 8.5 months. Hospitalizations, the lowest in 8 months. And fatalities, 7. That's over 3 days. So even that's a number continuing to trend in the right direction. And a lot of that, of course, is due to vaccines. Very quickly, what you can see here is 65 and above. We got 93% of those folks vaccinated. Good news, they're the champions, 55 to 64, catching up a little over 80%, both with what you might think of as herd immunity. Go to the other end of the spectrum, 12 to 15, we got about 25% of them vaccinated, and that's pretty good over a short period of time. The one anomaly, as we've talked about before, is 16 to 18-year-olds have a higher percentage vaccinated than 18 to 24 and 25 to 34, those so-called invincibles. But they're getting vaccinated. The number keeps going up. I was very happy to see that we've been downward trending in terms of the number of people getting vaccinated over the last 6 weeks or so. And this past week, we went up about 22%. You know, maybe half of that is related to the 12 to 15-year-olds. But the other half of that is people maybe feeling some of the incentives to get vaccinated. Maybe, drinks on us got people inspired. Perhaps the president's declaration that you no longer have to wear a mask, even indoors, if you've been vaccinated, but only if you've been vaccinated. Whatever the reason, it's good news. And those of you who are holding out, here's your chance to step up, and there are additional reasons to do so. The vaccine incentives, this is a broader strategy building off of Drinks on Us. It's called Summers on Us. And just very quickly, these are folks who are coming to us with ideas for which we're really appreciative. You know, on the left, you see all the, mobile food trucks all down there off of I-95 in New Haven, that is. And we have a deal for the foreseeable future. You go down and get vaccinated at one of those facilities. For example, next to the food trucks, they'll give you a voucher to have a free meal at any of those food trucks down in New Haven. So you're feeling hungry, here's an opportunity. Get a shot and get a free meal at any of those food trucks. On the right-hand side, you see amazing Lime Rock, a fascinating, fun place where, again, sign up, you go to Lime Rock, get a vaccination, and you'll get a free meal there, and it's really fun. They are open under new management. Worth taking a look. And if you want to find out more, you go to ct.gov COVID vaccine/summer. And by the way, if you're hosting an event where you'd like a mobile vaccination van to come, you think you have a lot of people there, maybe some incentive program like you see at Lime Rock, like you see at the food trucks in New Haven, go online. You'll find out, A, where you can find these events, or B, how you can plan the event where we'll bring the vaccine truck right to you. All right. If we've learned many things over this last year together, but obviously the importance of health care, accessible, affordable health care for everybody. A lot of discussion in this building about how we continue to expand access to health care and start by making it more affordable. Just very quickly, some of the things we've done, going back now a year or two, we made our pricing more transparent with cost and quality benchmarks so you can see where we are positioned against others, something Massachusetts did some years ago, representing significant savings, where you can see how you measure up compared to your peers. We use that as some leverage, reduced insurers' requested rates in 2021, saving you about $100 million. It was probably the lowest increase in insurance rates in recent memory. A lot of it is also COVID-related. There are a lot fewer elected surgeries going on. Those are relatively high cost. There's also an insurance department working hard to leverage that and bring down insurance costs for you. And also, we challenge the insurers to give us more options on the exchange for small business. I come out of small business. I know how small business has been crushed by escalating insurance costs over the last couple of decades. I'm really pleased that not only did requested rate increases were virtually flat for this last year, we added on 2 new plans on the exchange so you have more choice. One is the Cigna/Oscar plan online, and the other is Anthem. I think both represent about a 10 to 15% savings. So some help to small businesses if that's the way you want to proceed. As you know, we waived all out-of-pocket costs for COVID testing and treatment this past year. Thanks to our healthcare partners in helping us to do this. We wanted to make sure we took away any disincentive back then to get testing and now to get vaccinated. No out-of-pocket cost to you. We expanded telehealth, and our friends in the legislature made that permanent. And that means healthcare is more broadly available to those of you that don't have to go all the way to a doctor's office. You can find a significant amount of what you had to do in person can now be done online. And that's thanks to the telehealth expansion. And finally, we signed the best paid Family and Medical Leave Act in the country. And I think that's really important. Deirdre and I today were at Housatonic Community College. And what you can do with really strong prenatal support, which she'll talk about if you ask, and what we can do to provide better support for new moms in general. That's a Head Start for a mom, Head Start for their children, and that's what the Medical Leave Act helps provide. So the American Rescue Plan also supported our Access Health Exchange, otherwise known as Obamacare. It lowered premium for people who purchased their own coverage. In some cases, lowered premiums dramatically. Over half of our affordable or Access Health customers will now pay less than $16 per month, less than $16 per month. Individuals making up to $19,000, families of 4 making up to $40,000, less than $16 a month, zero premium, zero deductible. Individuals making more than $50,000, families of 4 making more than $100,000 will save on average $500 a month or $6,000 per year. As you know, we opened up a few weeks ago Access Health. It's going to stay open, I think, until August 15th. Close to 3,000 people are signing up to take advantage of this. And I urge you, if you're not insured, if you're a small business thinking about your options, this is something you ought to think about. It can make an enormous difference. I think overall, the bill says anybody can go on the exchange and you won't be paying more than 8.5% of your salary. So we're capping expenses, thanks to support from the federal government, in a way that can really expand access and reduce the cost of health insurance to you. Let's see. Connecticut CT can also build on the American Rescue Plan, because it's one thing to reduce premiums, but for many people, health care is still unaffordable due to the co-pays, due to the deductibles, due to those out-of-pocket expenses. So we've had a number of plans circulated around this building to think about how we can reduce costs. One is simply just to expand Medicaid to a higher income eligibility. Now, here, another reason I'm really pleased that Deirdre Gifford is our Commissioner of the Department of Social Services. Previously, on behalf of federal government, she helped oversee Medicaid. So she has some insights into the best way to provide a low-cost health access to all of our people, especially those least able to afford it. And she has helped take the lead with Johnny Doc in terms of, rather than simply expanding Medicaid to about 8,000 people, which is one of the plans here, at that same cost to us, the state of Connecticut, to us, the taxpayers, rather than Medicaid expanding to 8,000 people, we have a plan to eliminate premiums and out-of-pocket costs for 34,000 people, 4 times as many people who otherwise wouldn't be able to afford health care. In addition, we'll be able to cover all dental and other services for those same 34,000 additional people. We'll be able to provide prenatal care for undocumented moms-to-be. We can extend Husky postpartum care from 2 months to 12 months. This is a plan that Deirdre's been working on. I'm so thankful for it. It allows us to expand coverage to many more people at a lot less cost than any of the other options we've been focused on. And some of this we have to pay for ourselves. That'll be done through an assessment on the insurance companies. They're getting a big tax cut courtesy of the federal government. They'll be getting a slightly smaller tax cut, and that allows us to provide expanded health care options with no co-pays or no deductibles for anybody that can't afford it. In addition, as you know, you've got to get to the underlying costs of health insurance, and that's the costs of health care. We're working hard on the hospitalization side, and we're working very hard when it comes to prescription drug costs. I mean, why is it that Americans pay 3 times more for drugs, pharma, than people in other developed countries, starting in Canada? Why are you paying that? You're paying that through your insurance premiums. You're paying that, in many cases, out of your co-pays and deductibles. So we've got a plan in place that we are trying to get passed through the legislature. We're doing this in association with Massachusetts and some others, where we would cap the increase, just the increase in pharma costs to 2% plus inflation. So they get their initial cost of the drugs. They get a rate of return on all the investment they've had to make and all the R&D. But rather than have sudden increases in costs thereafter, you remember what happened with insulin a while back? Know what happened with EpiPens? That was notorious, where all of a sudden you need this, you've got it into your budget, you know what it's supposed to cost, and go up sometimes double and even triple digits. We're going to cap that to give you more security, know what's payable, and use that to help reduce health care costs overall going forward. And this is taking the lead. I think you're going to see in Washington, D.C., a bipartisan similar plan led by Chuck Grassley to do something similar in Washington. But sometimes they needed state to take the lead. Connecticut, let's take the lead here and make health care more affordable for everybody. And finally, as I said before, COVID just revealed the incredible health care disparities as they impact people, black and brown, based on income, having much more severe impact, in this case by COVID, due to comorbidities and other ongoing illnesses that they may have. That's why preventive care is so important. That's been a big piece of how we're going to prioritize our rescue plan money, universal home visiting, and community health workers. Look, if I could have done one thing differently over the last 6 months, it was when we said we're going to prioritize people over the age of 75 for vaccines. That was good. That worked. That saved lives. But rather than say go to VAMS, go to an online sign-up, which was complicated for a lot of people, especially complicated for folks of a certain age, we've learned to complement what you're doing online, going door to door, looking people in the eye makes an enormous difference. And that's what Deirdre's prioritized with universal home visiting and community health workers, doing everything they can so they know what options are available to them. For example, on the exchange for prenatal and postnatal care, going there for moms who otherwise wouldn't have access to a primary care doc, doing everything we can to make sure she and her kid get off to the best start in life. In addition, we're working on reducing unintended pregnancies, significant additional support for our local health departments. They were thrust right into the front lines of this battle of COVID. They performed heroically, but they need more support. We're giving them that more support. Quality child care going forward. I think we discussed that before, the biggest expansion of child care in the history of the state. And Deirdre can tell you a little bit more about the improved data systems that are really important as we try and track the impact of healthcare on people and make sure that we're taking full advantage of that. These are what we're trying to do in terms of expanding access, reducing costs for healthcare, something that was reinforced and turbocharged as something of import over this last 14 months of COVID. So with that, Deirdre Gifford is here, of course, joined by Josh and Paul.
Channel 3 Eyewitness News.
Yes, Governor, this may have been brought up last week, but now that we do have Dr. Gifford on the call, I'd like to follow up. We're coming up on the 6-month vaccination mark for the most vulnerable population. Any word on boosters for them and then eventually for the rest of us?
Welcome back, Deirdre.
It's looking like, at least for some populations, that booster shots may be recommended, but we don't have specifics yet, and we certainly don't have a timeline. So we are prepared for the fact that there may be a group, some subgroup at least, of the vaccinated population that might need a booster shot. So we shouldn't be surprised by that, but we don't know when or for whom exactly yet.
Okay, and then the mass vaccination sites, they've really been a popular choice for families with eligible children. How much longer are they going to stay open? And then when they do eventually close, how's the state going to pivot to reach the unvaccinated population? I know that you just mentioned the door-to-door outreach is going to continue. Anything else?
Deirdre, Josh?
Sure. Yes, as you mentioned, our mass vaccination sites are starting to wind down. Because we've reached, a high level, as the governor said, of our population having received their first doses. But we're still have plenty of places where people can get vaccinated. Our pharmacies are a huge part of the program, and they're plentiful and numerous, and walk-in appointments are available there. And we're also working more and more with our healthcare systems to start moving towards having more vaccine available in private physician offices and other offices. We're not quite there yet. We're still working on logistics with our federal partners there. But we will continue to make sure that there are plenty of places where people can get vaccinated even when the mass vaccination sites are closed down.
Thank you very much.
NBC Connecticut.
Hi, everyone. Catherine Loy with NBC Connecticut. Governor, have you spoken to the comptroller about the public option not going forward?
Oh, I talked to Kevin probably a couple weeks ago, maybe 3 weeks ago, about, some of my concerns, number one, not having the taxpayers underwrite the risk, and number two, playing on a level playing field compared to the other insurance entities. Things that came up when the public option was being discussed in the insurance committee, I think it was a month or so ago.
And as far as the health insurance tax goes, we're hearing some pushback on that. Are you still behind that? I'm
still behind that. Look, you can decide. I don't want to ask the insurance companies to give up a little bit of their tax cut. Instead, that would mean that, poorer people would have to pay a little more copay and deductible. I'd opt on the side of making it more affordable on the healthcare side.
Okay, and tomorrow marks 1 year since George Floyd was killed. How do you think we've done in Connecticut over the last year? I know we have our police accountability law that went into effect, but have we made significant changes, and are we on the path to making more changes, I guess is my question.
Well, we certainly made significant changes, but it was a year. And I think we all can see that video in living color right now, can't we? It was just shocking that happens in America. Shocking for me, maybe not shocking for some of you out there. I will tell you that I remember that next few weeks, I was proud about how Connecticut responded. I saw, parents, white, black, brown, often with police taking a knee, arm in arm, saying that we're shocked and outraged by everything that was represented by the murder of George Floyd, and it was a murder. You're right. The Connecticut stepped forward. We had the police accountability bill. There was a little back and forth about that, but I think it was the right thing to do. And I think that we continue to learn every day how we can make sure this is a more perfect union and a better state where nothing like that can ever happen.
Thank you.
Fox 61.
Hi, I have a quick question about the fall school year 2021. Any changes yet that you think we will see? We've seen some pushback from certain groups still really against children wearing masks in the upcoming school year. Deirdre, I don't know if you could speak on this, if there's going to be any changes or that's still what the school year is going to be looking like.
Sure. The CDC has said multiple times that they're planning to relook at guidance for the fall school year. So we'll certainly be waiting to see what they have to say. We don't think we'll have vaccines for young children in time for the start of school in the fall. So we'll have to see where things are with cases and what the new CDC guidance is to know for sure what the fall school year will look like. I think, we what we're seeing now is that the schools are doing a great job. Acting Commissioner Russell Tucker has been leading an effort called Finish Strong to make sure that the kids are finishing out the school year with minimal cases and getting back to some normal activities. And so we'll keep watching the case counts, and we'll keep watching the environment in terms of vaccination and see where things are in a few weeks before we'll be able to have specific guidance for the fall.
Thank you.
WTIC 1080 News.
Hi, Dr. Gifford, do you think that folks are considering the pandemic over? There's a lot of crowds at the beaches. If you look around, it seems like people think this thing is done. Do you think it's done, or are you concerned for our future still?
Well, we're not done with the pandemic. That's clear. We still have thousands of cases every day in the United States, but our case counts are coming down, and that's because in Connecticut, people have been getting vaccinated. So the way that we're going to end the pandemic in the United States, in Connecticut, and around the world is by making sure that as many people as possible as are eligible and get vaccinated. We're doing a great job with that, but we still have, as the governor mentioned, some pockets of our population that haven't chosen to get vaccinated yet. So I want to reach out and encourage, if you're under 35 and you haven't chosen to get your vaccine yet, talk to your friends, talk to your neighbors. It's going to help protect you and your community if you get vaccinated, and that's the path out of the pandemic.
Thank you.
News 8.
Hi, Governor. I saw that a lot of communities are canceling or have canceled Memorial Day parades. Is that the right call at this point, given our positivity rate and the mask mandate outside?
Look, it's up to the local community, but I'm looking forward to a few Memorial Day parades. I know a lot are scheduled. Obviously, it's outside. Little spacing is not bad, but I think every community can make their own call, but I'm looking forward to a few parades.
And Commissioner Gifford, I know you touched on this a little bit, but any sort of guidance as to when we might know for that 12 and under age group when the vaccines could be available? Are we hearing anything at this point?
Well, we know that there are trials underway. We understand that we will have data sometime in the fall. And then following data, there's usually an application for the modification of the emergency use authorization. So it seems like this year is a good bet that we'll have some further information and maybe an EUA for the younger kids, but still a little bit early to tell.
And Governor, one more question for you. I know you talked on this a little bit about how the VAM site was a little difficult for folks to use in the beginning. Any other decisions with hindsight now over the last 14 months, anything else you would have done differently at this point?
Oh, I think we didn't know a lot early on, as we've discussed before. But I think in hindsight, if everybody had started wearing a mask sooner, if people had started quarantining a little sooner, I think we would have been better off. We benefited a little bit because we tended to do things in coordination with New York, and New York tended to be, say, 3 weeks ahead of us in the COVID, so that meant we were relatively early in terms of making some of those decisions. But earlier still probably would have made a difference. And obviously, in hindsight, get the mask, stockpile the mask. Don't wait around for a stockpile in Washington. That's waiting for Godot. We're not going to make that mistake again.
Okay, thank you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Commissioner, when will visitations really be back to normal in nursing homes? We're still hearing about restrictions on where and when people can meet with their loved ones.
Well, we have been working with the industry and with our long-term care ombudsman, Mairead Painter, to make sure that all of the facilities know what the guidance is around visitation with vaccines, and both in the visitors and most of the residents and staff being vaccinated. The guidance is pretty close to being back to normal. So each time that DPH or the ombudsman hears about a situation where maybe there are some limitations and the facility isn't understanding or implementing what we're working with them on a regular basis, we continue to have regular calls with hundreds of people from the nursing home industry at DPH every single week to try to make sure that they understand the guidance. So it's been a long and difficult year in the nursing home industry, as you know, and some of them are having some challenges maybe switching back to the new normal. But we are continuing to work with them to push to make sure that individuals residing in nursing homes have access to visitation, because as we've learned, it's critical for their well-being.
How many complaints did your agency receive this year concerning care in nursing homes?
I'd have to go back and check, Sue. I don't have the number off the top of my head.
Okay. And Governor, you mentioned that this might be the last of the daily summary, but I assume the state will still be tracking these numbers, correct?
Obviously, we're going to keep tracking the numbers. We're going to have a meeting on Thursday, and then we'll see what it looks like for the weeks thereafter, Sue.
Okay. And on a totally different subject, the fantasy sports industry is saying that the way the gambling legislation is currently drafted, it would mean that thousands of fantasy sports players wouldn't be able to play for money on the sites for months, and that means that they would miss out on NFL. They say that your administration did not work with them on the negotiations with the tribe. I wonder if you can comment on any of this.
Why don't you take that, Paul? You've been leading those negotiations.
Thank you, Governor. Yeah, we've had conversations with the entity. As you probably are aware, Sue, in 2017, legislation was passed by the legislature to provide a mechanism and a way for daily fantasy sports to be legalized in the state of Connecticut. That mechanism wasn't triggered. Thus, as part of our larger discussion with the tribal partners, we provided for daily fantasy sports to be finally legalized in the state of Connecticut. So we're going to make sure that the industry is able to be legally played in the state.
Which entity are you talking about that you spoke with?
spoke to representatives of DraftKings directly. As well as Nora Danahy, our general counsel, who also spoke to them. But as I stated, Sue, this legislation that's going to be taken up by the Senate will truly, for the first time, have this industry to be truly legalized within the state.
Okay, maybe we can talk offline, but I have a lot more questions for you on this, if you could reach out.
Yep,
thanks.
You have my number. Feel free to call me.
Thank you.
Connecticut Public Media.
I'm seeing Westport School District is removing remote learning for next year. And I know New York City just decided to do the same. You know, going into next September, do you think remote learning should still be an option since or there's a possibility that some of the younger children won't be vaccinated yet?
I think it's pretty tough to do remote learning simulcast along with in-classroom learning school by school. I think that's asking too much. But I think you will see a more robust online offering made available statewide so that those parents who, for one reason or another, their kids can't go to school have that option. But we are going to encourage everybody to get to school that can get to school.
Thank you.
The Waterbury Republican American.
Thanks very much, Max. Dr. Gifford, is there any update on breakthrough cases in Connecticut? I believe there was 242 reported a couple weeks ago.
Paul, I don't have the latest number right in front of me, but we can certainly get that for you at DPH.
Okay. And have there been any reports in Connecticut of teenagers or young adults who got the COVID vaccine and then experienced heart problems?
Yes, we have had some of our providers reach out to us. As you know, the CDC put out an advisory about a week or so ago asking providers to look for cases. And so we've had providers in Connecticut let us know about 18 cases in our state. We don't know if these are vaccine related or not, but we have encouraged the providers to reach out and share the information with the vaccine adverse events reporting system, which they have done. And we've been in touch with CDC to make sure that they are aware of the cases. So they're studying this question. These have been rare. They've been mild and they've been self-limited, but we are tracking them and working with our federal partners.
And are there any behind-the-scenes discussions, preliminary as they may be, about vaccinating younger children and whether or not Connecticut would require vaccination to attend school?
You want me to take that, Governor?
Sure.
No. We, as I mentioned earlier, we don't know what the state of the COVID vaccine for younger children will be until we see the data and until we have information from the FDA and the CDC. So we are watching and waiting and encouraging the 12 and older to go ahead and get vaccinated. As the governor mentioned, we've seen a terrific response in the 16 to 18-year-old age group and a really quick start, almost 30% now of the 12 to 15. So lots of young adults are getting vaccinated, and we encourage them to do so.
Okay, and Governor, I'd just like to follow up on your comment about robust remote online offerings. Is it possible that that could be extended to children who formerly had religious exemptions for required school vaccinations?
I don't think it's going to be an official offering, but as you remember, we had a deal with Scholastic and others that put in, online classes around different subjects, make it much easier for those parents that, for one reason or another, their kids can't make it to school. But back to your vaccination question to Deirdre, obviously 12 to 15, 12 and above, we want everybody vaccinated. I want all the teachers vaccinated. That will answer 2/3 of any issues going forward.
But would you mandate it?
I don't think so, as long as people get vaccinated.
Okay. All right. Thanks very much.
The Hartford Current.
Hi, Governor. It's Eliza Fawcett from The Current. I wanted to follow up on the question about George Floyd's murder. In your mind, what is the work that remains to be done in Connecticut on the issues that were laid bare last year?
A couple of things. We're working right now to make sure that our social service agencies, make sure those specializing in addiction and domestic abuse, everything is not just a police action, that we have the right people going there to make sure we respond accordingly. I think that's very important. We're working on that. Secondly, I'm doing my very best to make sure we expand the ranks of people who are in our police force, and in particular, I'm paying attention to our state police. I want that to be a much more diverse group that represents the community in terms of more women, more people of color, better training so that our communities know that the police are there for them.
Thank you. And with COVID testing decreasing so significantly recently, what is the future of testing in Connecticut? Will surveillance testing continue indefinitely? Do you believe that major testing sites should remain open moving forward?
I think they will be winding down, but Josh, you want to take that?
Sure. And Commissioner Gifford can comment as well. We're constantly looking at what is the right amount of testing infrastructure that we need in place. There's going to continue to be people who will need to be tested, both who haven't been vaccinated, and monitoring of certain high-risk environments. But certainly, when we have half of the states been fully vaccinated already, the requirements are going to go down considerably, and we're scaling the infrastructure accordingly. But our healthcare providers are going to continue providing testing. The state will continue to support many of those programs. But fortunately, the need is declining.
I'll just add that, another perk of getting vaccinated is even after a known exposure to somebody who's COVID positive, if you're fully vaccinated, the CDC does not recommend that you get tested as long as you don't have any symptoms. So that's another one of the reasons why we're seeing our test volumes go down. Also, a lot of our testing was surveillance testing in nursing homes, college dorms, those kinds of facilities. And if you're vaccinated in those settings, you don't need to have regular surveillance testing. So it's a good incentive to get vaccinated, but also means we just don't need to have as much testing going on. But as Josh said, anybody with symptoms should still get tested, absolutely. And if they're unvaccinated, and we'll make sure that all of those resources are available for anybody who needs them going forward.
Is there any concern that without widespread testing at a certain point, it will be hard to tell if COVID is coming back, in full force at some point, or does the vaccination negate that?
Well, as long as we are not seeing widespread infection, in vaccinated populations, then the need for widespread surveillance testing will probably go down. So, as you've heard from our federal partners, from CDC and Dr. Fauci and others, it still appears that all of the vaccines we have available in the United States are effective against the most common variants that we're seeing. So we don't anticipate seeing a lot of severe infection in vaccinated people. So we will continue, as the governor said, to watch our numbers. And in the event that we start to see some kind of signal or some kind of uptick in cases in a particular area, then we would be able to expand our testing capacity if needed. But that'll be on a more targeted basis and not on the general population basis that we've been doing for the last year.
Thank you so much. And just had one last question for the governor. Governor, what is your response to business opposition to the $50 million tax on health insurance?
Well, I would rephrase that, Eliza. Health insurance is going to get a $300 or $400 million tax cut from the federal government, and we're going to allocate $50 million of that big tax cut to make sure that our poorest folks don't have big co-pays and deductibles. I think you're going to find that that makes it much more universally available. Look, I come out of business. Business wants the biggest tax cut they can get. That's what our job is. But my job as your governor to make sure that I find a way to pay for something that I think will really pay benefits, especially for folks who are most disadvantaged when it comes to getting health insurance.
Thanks so much.
CT News Junkie.
Thanks, Max. Governor, the House Speaker today was asked about the prospect of raising TCI, and he said it would probably be, if they did raise it, part of a budget or finance bill, and then it was part of the negotiations between you and the legislature. So where do you see that TCI proposal as standing at this point? Is that a make or break proposal for your budget deal, or might it wait for another year?
No, I think it's really important, Hugh. It's the Transportation Climate Initiative. We're doing that with Massachusetts and Rhode Island, other states to come. We have to be able to pay for transportation. We keep trying. Everybody says, I want, to speed up the rails and I want free bus service on weekends. Find another way to pay for it. They're having the exact same debate down in Washington. And just as importantly, it's really important from an environmental point of view. We're spending a lot of time on healthcare. We're talking about comorbidities. Those kids who live along highways where there are a lot of polluting buses and the such are much more likely to suffer from asthma and much more likely to suffer from COVID because of that. So, to me, you got to pay your bills in life. This is a fair way to do it. Put a small fee on pollutants, put a fee on asthma, and make the people that are polluting pay a little bit.
Would you say that it's would you accept a budget that doesn't include this, I guess is how I would phrase it?
Well, I get tired in this building. Everything is, make or break. This is it or you won't get my vote. Look, I negotiate. I got to get a budget passed. But I do urge people, you don't like how I'm paying for transportation. You don't like how I'm paying for environmental improvements. What is your alternative?
Okay. Another thing, where do things stand with the cannabis bill? Any news to report there?
Yeah, we're having, good, strong negotiations. Paul can speak to this as well. Jonathan Harris taking the lead. Broad agreement in terms of how we regulate marijuana. Broad agreement in terms of THC and making sure we do this on a health and safety basis. I think there's growing agreement in terms of how the money goes to those communities that have been most hit by the war on drugs, those most distressed communities. Of course, God is in the details, so I'll pass that to Paul.
Yeah, as the governor stated, we have our chief negotiator, Jonathan Harris, as well as other members of our staff working directly with the House and Senate negotiators. Thank Majority Leader Rojas for his work in convening the legislature on this matter. But one thing is, we're going to get to a time point. And as people who understand, there's going to be a lot of things that the legislature is looking to take up. And there's also a lot of things that members of our team need to work on in particular. So I know that there's going to be a time crunch, and we have been speaking to the legislative leaders about that. But we're getting closer to a bill that is acceptable to the governor and to the administration.
You think that's likely within a deal within the week or no?
I'm very optimistic, but as the governor says, it all comes down to the details. But time is of the essence, and but there's good progress that's being made. Hopefully, if we keep on that same pace, it can lead to a bill that can be called in both chambers.
All right. Thanks, guys.
Hearst, Connecticut Media.
Hi. What's the ballpark amount on the American Rescue Plan funding to support insurance premiums? Josh, maybe?
Yeah, you have that, Josh?
Stumped him, all right. It's a good day.
Well, but Ken...
Go ahead, DJ.
Yes. The premium support is the governor's proposal is funded through the health insurance assessment. So that's the proposal that would take the $22 million of those dollars and provide full coverage through the exchange for up to 34,000 people. And also capitalize on the premium support in the American Rescue Plan Act. So 0 premiums for those individuals, plus an additional support out of that health insurance assessment for out-of-pocket costs. And that would allow us, by using that mechanism, that would allow us to cover more than 4 times as many individuals than simply expanding Medicaid.
Oh, thanks, Dr. Gifford. And what kind of support, Governor, do you need from the legislature for these initiatives?
Well, the premium support is automatically provided, by the federal government. That doesn't come out of our American Rescue Plan. The subsidy we need to reduce co-pays and the deductibles is that $50 million fee that we've asked the legislature to approve. There's a lot of pushback on that, so we'll see where it comes, but it really would make healthcare so much more affordable for people who otherwise can't afford it.
So it's safe to say it's subject to further negotiations then on a day where both Democrats and Republicans have something to dislike in your plan.
Yeah, that's probably pretty true.
I think that's it for me. Thanks.
Thanks, Ken.
The Connecticut Mirror.
Thanks, Max. I wanted to follow up on one of Paul's questions. Dr. Gifford, do you know any of the 18 cases of the teenagers who, of course, my phone rings, who were reported had issues with the vaccine, were serious enough to be hospitalized?
Yes, all of the cases that were reported to us were individuals that were hospitalized, the vast majority for a couple of days. One individual that we're aware of is still hospitalized. The other 17 have been sent home, and they did fine.
And I also wanted to ask about testing in nursing homes. You talked about testing earlier. Where do you see that heading? We're still doing it, I believe, right, to some extent. Do you see that continuing through the fall, maybe waning off of it? What's the sense with testing in those facilities?
Yeah, so just as a reminder, the governor issued an executive order last May requiring weekly testing of all staff in nursing homes, and the state has been supporting that program financially since that time. Now with a very high percentage of our residents vaccinated and a growing percentage of staff vaccinated, we're seeing our cases and deaths in nursing homes plummet. And those outbreaks are becoming much, much smaller and much, much rarer. So we are scaling back on the weekly testing requirement for staff, and we're following the CMS guidance, which is if you're in a county with low positivity, which all of our counties are now, then there's only a monthly testing requirement for staff, and that's only for unvaccinated staff. Residents only need to be tested if someone in the building, either staff or resident, tests positive. So we're going from mandatory weekly staff testing down to monthly testing only for unvaccinated staff, and residents only need to be tested either if they have symptoms or someone else in the building tests positive.
And I know new people coming in are supposed to be vaccinated by the hospitals. Is that what's happening? Have you seen at least those that are transferred from the hospitals are coming in already vaccinated? Because obviously there's a turnover with nursing home patients, daily, certainly weekly, that you have to keep an eye on. I'm just curious, are the hospitals vaccinating most of the ones coming in from there?
We've been working with our hospital partners to encourage vaccination at the time of discharge to a skilled nursing facility. As the governor shared, our older population is almost completely vaccinated now. So we're seeing fewer and fewer candidates who need to be vaccinated when they are discharged to a skilled nursing facility. But our hospitals are one part of that solution. We also have partners in each one of our skilled nursing facilities now that can provide vaccine in the facility for any unvaccinated residents or staff. So there was a federal pharmacy partnership with CVS and Walgreens that has concluded, and now we have a partnership with local pharmacies and our nursing homes to vaccinate anybody who's there who happens to be unvaccinated.
Thank you.
the Day of New London.
Hi, everyone. Governor, I know you weren't in favor of the most recent iteration, but would you support a public option insurance plan bill in the future?
Not one where the taxpayers had to underwrite all the risk, and not one that didn't play by the same set of rules as the other insurance providers.
Okay, so that makes sense. What would it take for you to support it? I'm assuming, some combination of the factors you just mentioned.
I turned the question on its head. I think you've heard Deirdre describe we're taking advantage of what we can do on Obamacare, the exchange, Access Health, providing the broadest increase in accessibility for health care in an awful long time. We've got an aggressive plan out there which has the insurance companies contribute to the fact you don't have to have co-pays and deductibles, at least those that otherwise can't afford it. We're doing as much as we can in terms of preventative care, putting our American Rescue Plan money in place to do everything we can there. And we're going to bring down the overall cost of health care, starting with pharmaceuticals. So rather than, get distracted, I think that's what my priority is right now, and I really hope we get that passed.
Okay, would you say that is because maybe that's more appetizing, whether it's to the public or to other legislators, to have these sorts of other measures than going for the public option, or is there some other reason?
I don't know what appetizing means. I know this is the most cost-effective, most efficient, best way to expand access, so it's more affordable to people who need it and more affordable to the taxpayers overall.
Thank you.
All right, I'm getting the signal here. Everybody, thank you. Deirdre, great to see you back here again. We'll be back here on Thursday. I just wanted to give you one message. We've talked a lot about incentives people have to get vaccinated. We've got now you get the drinks on us or food on us if you go down to New Haven to the mobile food vans there. Obviously, you don't have to wear a mask if you've been vaccinated and indoors, which is sort of good. But I was reading the New York Times the other day. White House says dating apps can help the vaccinated and the frisky find love. And that got my interest, so I started reading through, and I found that those who go to Tinder and Cupid and other dating sites, we've been quarantined for a long time. There's a lot of people going to these sites. There's a check mark for category vaccinated. If you've been vaccinated, you're 14% more likely to have a date, 14% more likely to have drinks on us with a friend. That's a good incentive. Thanks, everybody.